As always, we're here to talk about digital transformation for the aged care sector. I'm Janine Bennett, the Engagement Lead for the Department's Digital Transformation Program and your moderator for today's webinar. I'm joining you today from the lands of the Ngunnawal and Ngambri people, and I'd like to recognise the traditional owners as well as the people and families with continuing connection to the land and waters of this region. I pay my respects to their contributions to this country and to elders past, present and emerging, and to any Aboriginal and Torres Strait Islander people joining us today. It's great to have you with us. Firstly, some housekeeping. Before we begin, I'll share with you that we've had some technical issues with another meeting today. Hopefully that's not going to affect us here at Tech Talk, but if you do lose connection, you will be able to go ahead and rejoin. Our tech support team are monitoring in the background, and as always, we'll send a recap and recording of the session after the event, so you won't miss anything. You'll be able to catch up later if you do drop off. If you're joining us for the first time, a couple of things to keep in mind. Our phone dial-in details are there on the slide, and they're also in your meeting invite in case you come across any connectivity issues throughout the session today. We record our session so that you can play it back yourself or share it with others after the event. And we post that recording to our website. That should be available in the next couple of weeks as soon as we have the transcripts done. As always, we keep an eye out for your questions. So go ahead and add your questions as you hear the presenters talking today. We'll put those to our panel during Q&A. If you'd like to get involved, it's really easy to ask a question. You just open up the Q&A tab in the top navigation bar in Teams, type your question so that it's ready and waiting. And when we get to our Q&A session, we'll try and get to as many questions as we can. If you'd like to ask a question live on camera, we'd love for you to join us on the Tech Talk stage. To do that, please make sure you include your name when you send your question in. When the time comes, I'll give you a quick heads up before we bring you to stage. From there, just make sure your video and audio is on, and then you can go ahead and ask your question directly to the panel. If you're feeling a bit shy today and you don't want to appear on camera, that's totally fine too. I'm happy to ask the question for you. Just post anonymously in that case, or write no stage on your question, and then I'll go ahead and ask the panel on your behalf. Okay, keeping in mind that our focus here is on Tech Talk and it's targeting the technology and delivery work we do under digital transformation, we'll answer all the questions that we can. If we need to take a question offline, if we're not quite sure of the answer in the room today, we'll follow up and let you know the outcome. I want to quickly welcome any media representatives attending today. We appreciate your ongoing interest in this important work that we're doing for the aged care sector. A quick reminder that media questions should go to the department's media and events team at news@health.gov.au. They're best placed to help you with those formal media questions. Okay, with our housekeeping out of the way, let's get on to the main game. On today's agenda, we're opening proceedings for our 20th Tech Talk with our routine digital transformation update, taking us through the latest delivery roadmap, including a bit of a look at what's coming in 2025, followed by a presentation on the Managing Your Organisation tile in GPMS, which recently went live. Then we have some folks with us from the monthly care statements who are doing a joint update from the department and Liquid Interactive. Next, we'll hear about our latest sector pulse survey, followed by a quick flashback for all that we've achieved together in 2024, and then we finish up with our usual live Q&A. Now it's my pleasure to introduce your host for the day, Faye Flavaris. Faye leads the digital transformation work and is currently acting in the role of Chief Digital Information Officer at the Department of Health and Aged Care. Faye is a very skilled technologist and an IT architect who brings her extensive experience in leading transformational change in private industry to her work here at the department. Faye, welcome. Happy 20th Tech Talk, and over to you.
Janine, and firstly, give me a thumbs up. Hopefully everyone can hear me. Yes, excellent. Okay, so welcome everyone to all our regulars. Oh, that's lovely. Thanks, everyone. And to anyone joining us for the first time today, glad to have you with us. It's good to see you all. A quick reminder to type your questions in the Q&A as we go, because that'll give people the opportunity to like questions up and get us ready for the Q&A section later on in the event. We'll also pop handy links into the Q&A as well, so keep an eye out for those as we're working our way through the presentation. Okay, so firstly I want to start by sharing that we've been doing continued presentations and collaborations across and engaging with the sector. In particular, to mention our digital transformation guest speaker series. As part of our guest speaker events, I and other members of the team present at different events when you guys want us to come as we're invited. And one of those events was the ACPA conference, the national conference in Adelaide, which was just one of the many presentations that we've done this year at various meetings, forums, conferences, peak bodies, all sorts of groups who want us to make sure that we're providing a channel where people can invite us to their event. We talk to them specifically about the elements of the program that are relevant to them and that might be of special interest. We're always open to presenting at forums like this, so it gives us the ability to have direct contact with you guys, provide you direct information around the work that we're doing, and it gives us the important opportunity to hear your experiences and your expectations on the key challenges and the priorities for the digital transformation. If you're interested in having us visit in 2025, you can reach out to the engagement office. Simply scan the QR code that you've got there for the email address, and we're putting it into the chat for others as well. So, okay, let's start with the delivery side of things. Now, here you'll see our digital transformation roadmap for 2024. This will be a familiar slide for our Tech Talk regulars. This is the plan that we've been tracking to and delivering to all year. And I'll draw your attention to the ticks at the top of the columns for each quarter. That confirms that these programs of work have all been completed and delivered. So in our last release in October, we improved star ratings, updated the B2G developer portal, and we made platform improvements to remove system-generated duplicates users in GPMS. We made some additional upgrades to the B2G developer portal and relevant Department of Health and Aged Care web pages to improve the user experience and ensure information is easily accessible based on some of the feedback you gave, and improved the Australian National Aged Care Classification Referral Management and Assessments to remove the manual inputting of aged care planning region details when the geospatial information is created or updated. We also made changes to the 24/7 registered nursing information to ensure that the additional funding is provided to very small facilities so they can keep increasing their nursing coverage and quality of care for residents. And that's just some of the things that we touched on. There was so many more, but I can't cover them all here because these were all very important and incremental improvements, but I know that talking about what we've done in 2024 is potentially not what you're all asking for at the moment. So how about we take a little look forward? As we've shared in our last Tech Talk, these are the projected delivery dates for 2025, with major releases planned for February, June and October. Here you can see there's 3 major releases for 2025, and you can see the associated sort of design, build and test phases that go with that. These are not our only releases, but our major releases. We also do put monthly sort of deployments and patches, but we won't showcase these at the moment. So since our last Tech Talk, we've been working really hard to provide more detail to this roadmap. And here it is. Our first cut at the digital transformation roadmap for next year. This is a forecast of the work up until June 2025. So we thought we'd share early. We couldn't give you the full year, but we thought we'd share what we have so far. So I'm going to share this with my usual disclaimer. Think of this as our technical delivery roadmap. It's our working plan. It is important to note This timeline supports the aged care reform agenda, but it should not be considered an official commitment from government. As I always say, these announcements happen elsewhere, usually via ministers and other formal mechanisms. What I'm sharing here is a working draft view of the planning we've been doing with our policy partners in the department and some of our other agency partners, with the caveat that some decisions are still pending and there might be shifts. And if this does happen and we need to shift something, we will let you know in the next Tech Talk and being very transparent about what's moved. As previously mentioned, we had 3 planned releases for 2025 in February, June and October. Here you can see the deliverables for February and June only ahead of the implementation for the new Aged Care Act. All right, so how about we dive in a little bit, specifically around the February release. We're making changes to My Aged Care portal to allow recipients exceptional circumstances to be captured. Information like Aboriginal and Torres Strait Islander statuses, or homelessness or at risk of homelessness, family connection reasons, or urgent residential respite information. In preparation for the new Act, we're making further changes to My Aged Care to support the rollout of the new supporting decision-making framework. Enhancements are being made to the single assessment system with the introduction of the new triage delegate role, and making enhancements to the assessment delegate form to reflect the new processes. These changes are being built in a dormant state. What that means is we're building it early and deploying it, but will not be turned on in the February release. We're updating terminology in GPMS and B2G to better reflect changes in terminology for the quality indicators. And an additional 3 new staff quality indicators will be added to the National Aged Care Mandatory Quality Indicator Program, with the focus on enrolled nursing, allied health and lifestyle officers. Star ratings, staff rating will be updated to reflect the combined care minutes for registered nursing and enrolled nurses. Providers and consumers will be able to view the new combined care minutes in various portals, and we're also adding in an explanatory note section alongside the staffing rating and overall star rating. The care services model will provide a basis for other business, product owners and project areas to consume and interact with this information. The care service model is defined as a set of reference data that stores the aged care services list and the categorizations according to the new Aged Care Act. We'll also have a set of attributes, reference data that is used to support the provider service delivery data, business rules, and the user experience during the business processes, such as the provider registration, support plans, delivery management, referrals, and much more. So you can see the care service model is a very foundational piece. Lastly, it will also include the relationships these entities have with other business entities to consume the care services data in support of business functions. So for more information and detailed information on those, we will provide more in coming Tech Talks, but also if you really want to get involved in the nitty-gritty on those, your sector partner community is the place to be, as we share a lot of the data elements as they come to fruition, and we share them early. As part of the provider preview, finally, we will email data to providers so that they can confirm the facilities, services and details have been considered correctly as part of the new legislative structure ahead of the launch of 1st of July next year. And we'll also be enabling the submission of supporting documentation to support the younger persons in residential aged care to support the younger persons in residential aged care delegate to decide eligibility for younger persons' access for government-funded aged care. And then finally, an enabling First Nation clients to specify their preference to be assessed by the First Nations assessment organisations. This is kind of like the executive summary of all we're doing. It's there's a lot more detail, but we thought this would be a good first cut to share with you. Everything I just ran through is also described here on this slide, and the deck will be made available on our website very soon, so you can reference the detail in your own time. Lastly, I'd wanted to brief you also on the digital maturity research project that we're doing. We've heard it loud and clear from the sector around concerns being digitally ready for the reform is something they've got front of mind. So we know that digital maturity is an important driving force that will help organisations such as yours and our own to thrive. So the department is committed to exploring how aged care providers and the software industry that supports them can keep pace with us while leveraging the benefits available for digital innovation. To that end, we're conducting a study on digital maturity. The aim is to better understand the benchmark of our current digital maturity levels across the aged care sector, and we hope that the insights from this research will inform policies and supporting mechanisms to bolster the sector's digital readiness and growth into the next year. Our research tackles 4 important questions. Firstly, what is the current level of digital maturity for aged care providers? Second, what are the key barriers and challenges to aged care providers improving their digital maturity? Third, what do aged care providers need help on to improve their digital maturity? And lastly, fourthly, what are the core elements of the digital maturity for aged care providers that lead to success? To answer these questions, we're going to need your help and input. Already, we've been meeting with some key groups, conducting workshops and deep dive interviews. And soon we'll be launching a digital assessment survey for all aged care providers and the software vendor community that supports them so that you guys can complete for us. We've been hoping to launch the survey this month, but we hit a conflict with a few other surveys that are going out. And so to take the pressure off the sector, we're now aiming to release this in late January. So watch that space for it. We encourage you to keep an eye out for the survey. We'll promote it broadly so that you can get involved. And we really need you guys to participate and be honest, as we value your honesty and the raw engagement that we get, including the hard truths. So that way we can make sure that we're addressing any concerns you guys have in order to get ready. So I say it like cheekily, but so don't hold back, but please be nice. We just need to hear all your concerns though. Okay, so that's kind of the update on our delivery roadmap. Hopefully that's been some waiting information that you've all been waiting for eagerly. On to our next agenda. I'm pleased to welcome Amanda Smith, who is here to update us on the GPMS Manage Your Organisation tile. Amanda, over to you.
Thanks, Faye, and hello everyone. I'm Amanda Smith. I'm the Assistant Secretary of the Aged Care Transformation and Quality Branch, where we oversee the development of GPMS. The GPMS journey has provided opportunities for the department to work with the sector on getting the solution right. And I'd like to start by reiterating that without this strong collaboration with you guys, we couldn't have reached the important milestone we have to date. In July, we provided you with an update about the Manage Your Organisation tile, which was formerly known as the self-service portal, and we were letting you know then that it would be available soon. And I'm pleased to say it is now live and ready for use by approved providers in GPMS. So what this means, you can review your information and make the necessary updates in the Manage Your Organisation tile. So now you can update provider details, service details, key personnel and contacts, third-party arrangements, and all using the new Manage Your Organisation tile. As we all start to get ready for the implementation of the new Act that Faye was talking about earlier, we ask that you all make a point of going in now and checking that your system details are correct. That would really help us with the range of changes and data migrations we have to do. We have also developed 6 videos to help you get familiar with new functionality in GPMS, all of which are available on the health website, and I think the team will drop some of the links into the chat there. Today, we're going to share one of those videos with you. This video is targeted to provider staff for both service and organisation changes, as well as provider governing persons to help guide them through the process of completing a digital notification form to update organisational details through that manager organisation tile. We'll play that now to give you a preview of what to expect when using the functionality.
Welcome to the guide on how to complete a notification form on the self-service portal. The provider logs into the self-service portal and is presented with the portal landing page. The provider wishes to complete a notification form, and they select the Manage Your Organisation tile. On the Manage Your Organisation page, the provider can initiate a notification form by selecting the Begin Notification Form button. On the Notifications Workspace page, the provider is able to view the Before You Start information, which includes sections for privacy and your personal information, notice of collection, and who can approve and submit this form. The provider wants to notify an organisational change and selects the Add button from the Organisational Changes section. From the list of organisational change options, the provider selects the Change to Organisations Governance option and then selects the Next button. On this page, the provider selects Board or Governance Committees as the type of organisation's governance change. The provider then fills out the fields for this change, which includes the detailed statement describing the change that has occurred, the upload of any supporting documents, the date when the change came into effect, reason for the change, and how the change affects the suitability of the approved provider. The provider then selects the Complete button and is taken back to the Notifications Workspace page. From this page, the provider wishes to notify of a key personnel change and selects Add from the Key Personnel Changes button. From the list of options, the provider selects the Add as a New Key Personnel option. Note that the provider is also able to select to update a key personnel's details, cease all key personnel roles, and also report on suitability as key personnel. For the purpose of this recording, the provider only selects the Add as a New Key Personnel change and then selects the Next button. The provider then searches for a contact through the first name and last name fields. Selects Search, which returns no matches. The provider then selects the option to create a new contact record for the person above and add them as a key personnel, and then selects the Next button. On the Add Personal Details page, the provider enters the personal details of the new contact. This includes the title, first name, last name, and date of birth, and then selects the Next button. On the Add Position Details page, the provider enters the position details, which includes position title, date they started as a key personnel, principal purpose of key personnel position, duties of position, employment type, main contact number, and email, and then selects the Next button. On the Add Individual Screening Check details, the provider selects the type of background check that has been completed. Have you received the outcome of the worker screening check, NDIS worker screening check number, NDIS worker screening check expiry date, and upload of the worker screening check number. Once the document has successfully uploaded, the provider then selects the Next button. On the Add Insolvency Check Details page, the provider completes the following fields, which include date the insolvency check was completed, the search ID, and upload of the insolvency check document. Once the document has successfully uploaded, the provider then selects the Next button. On the Add Disqualification Details page, the provider answers the following question regarding the disqualification status of the key personnel, and then selects the Next button. On the Add APRA Registration Details page, the provider then completes the following fields. Are they currently registered with APRA? Are they responsible for nursing services? Registration type, registration number, the copy of the APRA certificate, whether the key personnel's name is different to the one shown on the APRA registration, and the copy of the statutory declaration. Once the document has been successfully uploaded, the provider then selects the Next button. On the Add Membership of Governing Body Details page, the provider completes the following field. Is the key personnel a member of your governing body or quality care advisory body? In this scenario, the key personnel is not, and the provider selects the Next button. On the Add Qualifications page, the provider answers the following questions regarding relevant qualifications. Do they have any qualifications relevant to the position held? The name of the qualification, educational facility, and date obtained. The provider then selects the Next button. On the Add Relevant Experience page, the provider would complete the following fields. Do they have any experience relevant to the position held? Name of the employer, role title and description, role commencement date, and role cease date. Once done, the provider then selects the Complete button and is taken back to the Notifications Workspace page. The provider now wishes to submit the notification form for review. On the Notifications Workspace page, the provider can add an authorised representative and a governing person. The provider selects the Edit button on the Authorised Representative box and is able to enter the details of the authorised representative, which includes full name, role, position, phone and email, and then selects Confirm. The provider then selects the Edit button on the Governing Person box and is able to select a governing person from the list of governing persons available at the organisation, and then selects Confirm. The provider then selects the View Summary button and is then taken to the Summary of Changes page. On the Summary of Changes page, the provider can review the notification and then selects the Send for Review button. The provider then sees the confirmation page stating that the notification has been sent to the governing person for review and submission. And that's how a provider staff organisation user can complete a notification in the self-service portal.
Thanks, team. Love a good video. For more information on how to update your organisation's details, as I mentioned, we have resources available on our website. You can also scan the QR code on the screen to revisit the presentation we did at our July Tech Talk. Just remember, self-service portal equals manage your organisation tile. We just thought that title was a bit more meaningful. And that's all for today. We're happy to take questions on GPMS and the manage your organisation tile, but for any policy-specific questions, I'll need to take them on notice and connect in with my business counterpart, Emma Cook. But we'll make sure we get back to you either offline or at a future meeting if there's anything you would like to ask. And on that note, thank you for listening, and Faye, back to you.
Thanks, Amanda. And I hope you found the video instructive, folks. That will be made available elsewhere so you can refer back to again. We are debating just how much of the detail we bring here to Tech Talk versus how much is it learning material to be put elsewhere. If you have an opinion, it would be great for you to drop it in the Q&A. And that way you can vote it up one way or another. But we do think there's a lot being done, and we are just trying to over communicate and share. So please keep providing feedback on the best way to communicate some of this detail. Okay, now on to the next item for today, a joint presentation about monthly care statements. Katie Roberts from our Quality Assurance Division will be joined by the guest presenter Steve Marinan from Liquid Interactive. Liquid Interactive. Katie will update us from the department's perspective, while Stephen will speak to the software aspects. So, Katie, over to you. Just take yourself on mute. Excellent.
Thanks, Faye. Good afternoon. I'm Katie Roberts, Director of the Resident Experience and Food Policy section in the Quality Assurance Division, and my team is responsible for implementing the monthly care statements. And as Faye said, I'm joined here today by Stephen Marinan, who's a partner at Liquid Interactive, and he's working with us on a project to help us look at software solutions for the statements. But before I hand over to Stephen to discuss the project, I just wanted to give you an overview of the statements and where we're up to with implementation. So monthly care statements are written statements that providers can give to residents and their representatives each month. They were announced following the Royal Commission into Aged Care Quality and Safety to address concerns raised about a lack of communication between providers, residents and their representatives. And communication remains one of the top 10 complaints raised with the Aged Care Quality and Safety Commission, which is reflected in their quarterly sector performance reports. In terms of their content, the statement summarises the care the resident has received over the previous month, changes to the resident's health or care needs, and any other relevant events that occurred during that period. And for all residents, the statements should include information on wellbeing activities, which might include the social activities or arts and crafts, exercise, those sorts of things, changes to medication, appointments and hospital visits, and nutrition and weight. And when relevant to a particular resident, the statement may also include summary information around a diagnosis that's relevant to a person's care, wound management, mobility, and falls. So while the main audience of the monthly care statements is the resident, they can also be provided to another person if requested by that resident. Obviously, explicit consent would need to be obtained and recorded from the resident for that to happen. If the resident doesn't have the capacity to receive and understand statements, the providers may be able to give those statements to the representative. The statements can be delivered on a rolling basis or on a set day each month, providing flexibility to suit the provider. And for written statements, they can be delivered as a hard or a digital copy, depending on the preferences of the provider and the resident. Some components of the preparation of the statements will count towards care minutes. So a clinical review of the statement, for example, determining whether changes to a resident's care plan is required, and any follow-up conversations and activities that relate to refining and amending a resident's care plan will count towards care minutes. It's also important to note that residents will have the opportunity to opt out of receiving the statements. We also recognise that it wouldn't be appropriate in some scenarios to provide a statement, so residents receiving respite care or palliative care don't need to receive a statement. So we see the key benefit of monthly care statements is giving residents important information about their care in a single statement. And these can act as a prompt for further conversations with the provider about whether care needs might need to be adjusted. In proactively providing this information, residents will have confidence that their provider has listened and acted on their request and feedback. The statements will also help increase visibility of residents' care assessments and planning results, which providers must make available to them under the aged care quality standards. Monthly care statements also offer benefits to providers. They give providers a view of the residents' care needs in one place, which helps to review and adjust care management plans, improve communication with residents about their needs, address concerns in a timely way, and identify trends in the feedback received, which can help improve care across the home. The statements are being introduced through a staged implementation approach, which has started with a voluntary period. That period commenced on the 1st of October. And so far, around 50 providers have informed the department that they're offering statements to residents, and we're hoping there'll be more engagement from providers as the voluntary period progresses. The Australian government has not yet made a decision on when the statements will become mandatory, and we expect there will be learnings from this voluntary period that will inform the mandatory national rollout. During the voluntary period, the statements can be introduced in a flexible way that suits the provider, helping to build up to full implementation for when statements become mandatory. For example, during the voluntary period, providers can choose to give the statements in a written format or even as a verbal update, which could align with other communication mechanisms that might already be in place, such as resident of the day processes. Providers could also choose to deliver the statements at a less frequent cadence, for example, every 2 months or quarterly, or even to a subset of residents during this voluntary period. We've developed some guidance material to help support aged care homes during this time, including guidelines and a template for the statements, and these are available on our website. Just scrolling down, sorry. Lastly, I'd like to encourage you to let us know if you are participating in the voluntary period or would like to be involved in the software pilot, which Steve will talk to you about in a moment. Please use the QR codes on the screen to register your interests. So now I will hand over to Stephen Marinan to fill you in on the monthly care statement software development project. Thanks, Stephen.
Sorry, apologies, just a few technical issues. Thanks, Katie. It's nice to be talking about our work on the monthly care statements digital solutions pilot again. I was fortunate to be given the opportunity to present to the sector in a different forum in August. And for those in the audience here today who are able to make that session, I will cover a lot of the same ground, but we do have some initial findings from our engagement so far to share with you today. So everyone, I'm Steve. I'm a partner at Liquid. We're a digital design consultancy who have been engaged by the department to conduct a pilot of digital solutions to reduce the administrative burden of the monthly care statements. So today, I'm going to give you an overview of the pilot, tell you about where we are in our journey so far, share some initial findings from our engagement with the sector to date, and let you know that we still have spots left in our pilot for both aged care homes and software vendors to participate. So if you are interested in monthly care statements and evolving your capability, we'd love to hear from you. We'd love your participation. So as mentioned earlier, the Australian government has committed to requiring residential aged care providers to issue individualised monthly care statements, as Katie mentioned. These statements detail the care provided to residents over the previous month and any changes in their health status across 4 key categories mentioned: medication, appointments, well-being, and food and nutrition. So prior to Liquid being engaged by the department for these digital solutions, research and trial had been done in this space already. The research revealed that residents found the statements useful for both tracking the care they received and as a reference point for future planning. And this research and trial previously recommended 2 key recommendations. As Katie mentioned, a voluntary period was recommended to allow aged care providers time to adjust to the new requirements of preparing monthly care statements, and the development of a digital solution or solutions to automate the generation of these statements was recommended to reduce the administrative burden on providers. And this brings me to the digital solutions pilot. So next year, Liquid will run a trial of digital solutions for monthly care statement generation and presentation in February. This pilot focuses on testing solutions to reduce the administrative burden and will collect feedback from aged care homes, residents, and software vendors. We have completed our initial research phase, and we are now in the second phase of our project, which is co-design. This co-design phase will assist in finalising the digital solutions and determining the approach for their trial. What we've heard so far from the sector is that software vendors are seeking more clarification around the audit and record keeping requirements that will be implemented when the statements become mandatory. And aged care providers are looking for more options to deliver this information, as they're often delivering this information verbally and continuously. The example there being communication of falls often happens over the phone personally, and needs to be tracked within the current system, but may not currently be. Based on this, we think there is a really good opportunity for collaboration through this pilot to meet each of these needs. If software vendors are seeking more clarification around requirements, this pilot is a great way to find out more. And aged care providers can obviously work with software vendors and Liquid to see more options about what they can do to build capability. So we've still got spots left in our pilot. The message for aged care homes in the audience: we can assist you with implementing solutions to automate the creation of monthly care statements. And for software vendors, we'd love your input in making the standards and guidelines of statements feasible and achievable. So I'm here to say, if you haven't expressed an interest and still want to participate, please fill out our EOI form. Details on how to do that are on the next slide, or on that slide. And if you have expressed an interest previously and decided not to participate, there is still time. If you want to change your mind, please reach out to us again. And thirdly, if you have expressed an interest and want to participate, and for whatever reason we couldn't get in touch with you, please email us again at mcs@liquidinteractive.com.au. You may not be able to complete the form again due to the technology we use to collect these expressions of interest. So how can you participate? As you can see on screen, scan the QR code and complete the short EOI form. After that, we'll be in touch about how you can contribute to the co-design phase and what you can do to prepare for trial next year. Or if you have any questions or would like to speak to us directly, please email us at mcs@liquidinteractive.com.au. Cool. Thank you.
Thanks both. Thank you, Stephen and Katie. Appreciate the update. As you've just heard, there's still scope for aged care homes and their software providers to participate in the pilot. If you didn't catch the nomination link, the team will put it in the chat. Okay, so now it's time to talk about our upcoming aged care reforms sector pulse survey. And now I understand, Stevie, you're jumping in at the last minute for this. Thank you very much for joining us. And we're glad you could be here with us. So over to you.
Thank you. Well, thank you. And also thank you for the invitation as well. So I am Stevie. I am the Director of the Change Management Office, and it is really lovely to be invited back. I was here earlier this year in June, but for those of you who may not know me, my team is responsible for the change from the people and business perspective. So we do support the broader aged care reforms by working with individual policy and project areas to design and develop, as well as deliver those activities that support the transition through the change, including what this means for you. So what I'm here to do today is I would really love to encourage you all to participate. We do have an upcoming Sector Pulse survey, and we're planning on running this from the 25th of November. So normally we do run this for between 2 to 3 weeks, and so that will be coming out, and you'll be able to access this through the engagement hub. And the engagement hub, you'll notice that there is a link there. So we are also hoping that your responses do help to provide us with a greater understanding of your and the broader sector awareness, preparedness and adoption of the aged care reforms. And the survey will be released across various channels. And we have provided the QR code, which I was just referring to the engagement hub, which is where you will be able to find the survey when it goes live. So just to provide a little bit of background, our Sector Pulse surveys are administered by us here in the Department of Health and Aged Care, and specifically within my team, which is the Change Management Office, to measure. They're really designed to measure the sector sentiment, adoption, readiness and confidence across the reforms. We do conduct these Sector Pulse surveys twice a year, and this one is actually our 5th survey. And this has been a little bit of a collaboration between a couple of different business areas, both my team as well as our systems strategy and network support branch, who are responsible for the state and territory offices. So one of the things we noticed in our most recent pulse survey that we ran in June, and that was pulse survey number 4, was that we only really received 0.3% of respondents who were identified as technology enablers. It was an increase on the previous result, but the previous result was still only around that 0.2%. So it was a pretty marginal increase with that. What we would like for you to do is we would really hope to increase this participation, as we do know that there are quite a number of technology-enabled projects that have been included in this survey. And these include the business to government, GPMS, which we were just discussing through the provider gateway, My Health Record through My Aged Care, as well as the integrated assessment tool. And what we would really like to hear from you is about what you need from the department to help you manage the reforms. So what we have heard in the past is that you've consistently told us, or the broader sector has consistently told us, that there is a lot of work to do and there's a little bit of feeling overwhelmed by the reforms. So this sentiment did remain unchanged from our previous surveys. And we did hear that some of the barriers to those implementation and adoption were really around that lack of time to implement the reforms, short implementation timeframes, which we believe is still impacting the sector's ability to plan or mobilise the resources in the time required, workforce shortages and incumbent care professionals managing the administration rather than necessarily providing the care, access to funding and grants, and timely and targeted information that's relevant to your organisation and also to these changes. We have heard also what supports you need or what things you find are most useful and are working well for you. And we are continuing to provide these, and you'll hear that very much in this. And that includes things like webinars, the online step-by-step guides, as well as fact sheets. We are also working directly with the policy and project areas across the reform. So we will be feeding your responses and building those responses back into the change activities and timelines. We'll also be establishing an approach to monitoring these activities and using this survey, as well as other methods, to measure the effectiveness of these change readiness activities. So yet again, really, I'm just really hoping that you can participate in this survey, because all of the information that we gather from this really does help us structure those change activities as we move forward. And just a little bit of a reminder that that is opening on the 25th of November. And thank you very much, and thank you for the opportunity today. Thanks, Faye.
Thank you. And if I'm not mistaken, we have heard through the pulse surveys that people do like the tech talks and the sector partner community. So that's nice to hear. And if there's any other suggestions that you guys want to make, that's the pulse survey. That's where you can, get your feedback in. So as we mentioned earlier, today we're on our 20th Tech Talk. I'll just ask to move to the next slide, folks, unless that's me. Thank you. And it's our final one for the year. And so we thought it might be nice to round it out by looking at some of the achievements that we've all done together. It's timely for us to have a bit of a pause and reflect on the progress and celebrate a little bit of the successes that we've delivered all together. So before we move into some Q&A, I wanted to briefly share with you the origin story for this forum. And I wanted to especially thank my wingman to these Tech Talks, my engagement lead, which is Janine, who's been your favourite moderator on all of this. Hey, Janine, there you are. Janine, I think I'm safe to say that you've been big part of the guiding force behind this with me in the Tech Talks and the Sector Partner Group, and also the other engagement channels where we do, guest speaker series. And from the outset, I think we've made engagement a core pillar of our transformation program and how we do things. And you and your team who've helped me and the broader department deliver on that commitment, I just want to do a big shout out to you guys and say thank you very much. I'm putting you on the spot now, so I'm not sure if she was ready for this, folks. But what's your take on how engagement and how Tech Talk is particularly fits our vision together and how we work with the sector?
All right. Well, I'm always ready to talk engagement, so so I'm happy with that. And just to say, all of these channels that we use, it takes a village to do it. We have lots of technical SMEs who lean in and help us present information. We're talking about their hard work. So thank you to them for trusting us with the work and letting us sort of showcase all that they do. But Faye, when I think about how we kind of started out, we started with a challenge from you. And you basically came to me and said, we have to make sure that this digital transformation keeps the sector front of mind in everything we do. And so that was the broad vision and scope that I had for at that time, just myself, and that's grown into a big group of people who help me deliver these things. So we started out by setting some really
Janine, I think your reaction might have been that.
There was a time when I had that reaction. I'm about to tell you about it. But we started out by setting some really basic core principles about how we wanted to engage with the sector. We knew that we wanted to talk about what we were doing, but we knew we also wanted to listen. So we didn't want to work in isolation. We wanted to build partnerships to join forces with the other creative, smart, motivated people who, in and outside of government, were trying to make a difference for the aged care digital ecosystem. We knew that we wanted to be transparent, to prioritise openness over perfection. And that was scary to do at times, but we wanted to be really upfront about where we were at. And when we couldn't share something for, good reasons, because we're government and sometimes we have to take care with what we talk about, we wanted to be really upfront that we weren't in a position to share. It was really important to us that we engaged regularly and reliably. So regardless of what happened with the program, if we hit a deadline, if we missed a deadline, if we were able to share legislative intent or we weren't, we wanted to keep the conversation going. And we decided really quickly that we wouldn't shy away from tough conversations or tough questions, and that we would embrace as much robust and lively discussion as we could, because we feel like that's where the gold is. That's where we're going to all learn the most. So our plan was to release a suite of simple channels that would help us engage. So the Tech Talk is one of those channels. We kicked off the Tech Talk in April 2022, if you can believe that. I had less grey hairs back then.
You and I both.
Yeah. We had about 400 people turn up to our first Tech Talk, which was a bit of a shock to me at the time. I thought if we got 30, I'd be pretty happy. And I don't know if you remember, Faye, but I was actually on rec leave that week of the first Tech Talk, but I refused to miss it. So I actually dialed in from the hotel room in Tasmania so that I could host the event. The technology held up.
There's dedication.
It was totally worth attending. It was a great event, and I was so happy to be involved in it. But I don't know if you remember, speaking of shocked faces, I think it was that Tech Talk, or it might have been the second one. I'm pretty sure it was the first one. In our very first Q&A, you asked one of the attendees to be brought to stage for the Q&A panel. And in the background, we hadn't tested that. We didn't know how to do it. In the background, we're all freaking out, thinking, oh my goodness, how do you bring someone to stage? So we did it on the fly. I'm not going to say we didn't panic, but we figured it out. That was how our live Q&A was born. So it's been a Tech Talk standard ever since. I think it's one of the standout elements of the Tech Talk series, is that great discussion we get between the panel and our attendees. So thank you for that, I guess. It came to be a good addition to the suite. Okay, so the other foundational channels that we have, you've talked about it before. We talk about them a lot in our Tech Talk sessions, our sector partner group. So this was an invitation that we put out to the sector in April 2022, and we formed a group of about 30 volunteers in May 2022. These are our sector volunteers who meet with us each fortnight to co-create, co-design, co-deliver our digital solutions. It's quite an intimate group. It's a very dedicated group and a very giving group of their knowledge and their expertise and their opinions. At last count, that was at the end of October, we had 225 members in that group. So, not that I'm great at math, but that's a 580% increase on the just over 30 members that we started with. We see that as hugely representative of how invested the sector is in this aged care transformation. And then we also have our guest speaker series, which you talked about earlier in today's Tech Talk. This is where anyone from the sector can invite us to come and speak about aspects of the digital transformation that are of particular interest to them. So we present at all types of events, small NGO meetings, international conferences, everything in between. And all that happens under our guest speaker series. If you'd like us to come and talk to your group, just send us an email and we can get that on the list. This year we've done over 50 events as part of that guest speaker series. And then lastly, everything we do, we try to make available publicly so that it's searchable online. So we have lots of information up on the department's website. We use other popular channels like YouTube and LinkedIn. We hope to use a little bit more on LinkedIn next year, so stay tuned for that. But that's really about making everything that we talk about visible and easy to access and available to all. So I suppose in summary, I would say for us, it's about creating the spaces where we get to talk to people often and we get to have those conversations that will drive better solutions. You, as our sponsor, give us permission to showcase the incredible work of the delivery teams. But you always encourage us not just to focus on the technology, but to create ways to make sure that our digital solutions are working for people in the real world. So in that spirit, we have pulled together a bit of a 2024 achievements video that we'd like to share with you and our tech talkers today. But before we do that, we'll do a quick group exercise. So this is only our second meeting using Teams. So this is a little bit of an experiment with the Teams functionality. So we'll see how it goes. Everybody cross their fingers. As an engagement team, the challenge for us is always what information can we deliver that's going to be most useful for our very broad audience, and how do we make best use of the time you invest in us? So to help us figure out our plan for 2025, we're going to do a bit of a word cloud game. So I'll get the team to launch the word cloud. If you don't see the poll on your screen, you can click the polls button. It's in the top menu and you can open it from there. And the question is, what do you want to see in Tech Talk in 2025? Just add anything you want to see. For some of you, it might be details about support at home or NACA, or the new Aged Care Act, I should say. For others, it might be AI or more time for Q&A. Whatever it is you want to hear about, drop it in here. So I can see we've got a healthy number of responses there. This will be really helpful in planning our agenda for next year.
Amazing there, Janine. I can see definitely support at home is front and centre. That's very understandable given the focus for 1st of July next year. I think people are going home services. There's a bit of digital systems in there. Home care, yep. What else have we got? AI
innovation. That's a good one.
Yeah.
Yeah. Integration's another one coming up. Reporting.
Lovely. Just the changes in general. I get that. Like people are saying, what's changing? So we're definitely going to be making that front of mind. Services Australia. Yes, we're definitely partnering with them. So the roadmap we shared today actually is being discussed with them in consultation. They have promised to come early next year and present at Tech Talk, and also to the sector partner community on some of their work. So that's a great one.
And we'll try and get a little bit more into the Services Australia channels as well. So there's a couple of forums that we've presented at this year, but we'll work on broadening that out next year as well.
And while everyone's doing this, and we'll put the results in, I do want to take the opportunity to thank everyone for connecting with us and providing their valuable time to provide us feedback. You know, the sector partner community, they're so engaged. You guys are really providing insight into how things work or don't work. And so we really appreciate that. So maybe we move to our bit of an end of year celebration on what we all accomplished together. You know, digital transformations are really difficult, and we do need to stop. It's been about 3.5 years that we've been on the reform, and we do need to stop and take stock of what we're achieving to keep re-energising ourselves for the next waves of change. So over to you guys to press the play button and play back some of our achievements.
Hello. At the Department of Health and Aged Care, we're delivering real-world digital solutions to enable aged care reform. Introducing better technology to improve the experience of Australians navigating the aged care system. Releasing digital capabilities that are better connected, human-centred and modern. In 2024, we've delivered over 30 project outcomes across 9 major releases, bringing enhanced features and new tools to the aged care digital ecosystem. We're continuously enhancing My Aged Care, your gateway to the Australian government-funded aged care services. We've added finance and operational information for residential and home care providers to the Find a Provider tool. We're improving the processing of residential care notifications from Services Australia to include respite care recipients. We've updated system rules for palliative entry to streamline the palliative care classification process. We're laying the groundwork for key initiatives: the Assigned Permanent Residential Aged Care Places to People initiative, which allocates residential aged care places directly to older Australians rather than providers; the Single Assessment System, essential for the success of the new Aged Care Act and Support at Home in 2025, and for the My Aged Care Hospital Portal, expanding access to public and private hospitals to improve information sharing between hospital staff and aged care assessors. To support ANAC assessors, residential service providers and departmental staff, we've enhanced referral management and streamlined the reissuing of referrals. We also introduced the Integrated Assessment Tool, IAT for short, for aged care assessments, offering a consistent evidence-based experience. This tool reduced the need for reassessment with an improved triage function that captures and retains better data throughout registration, screening and assessment. The Government Provider Management System, GPMS, is our cloud-based provider portal offering easy access to essential information and tools for regulatory reporting and compliance. This year, we've launched new functionality to support and enhance quarterly financial reporting, 24/7 registered nursing, care minutes, star ratings, the stakeholder and emergency management system, and much more. Electronic signatures are now enabled for the provider operations form. The new Manage Your Organisation tile allows aged care providers to submit digital forms to the department and the Aged Care Quality and Safety Commission, simplifying organisation and personal information maintenance and regulatory reporting. As of November 2024, this tile has supported over 330 provider organisations and streamlined the processing of over 320 forms to the Commission. With exciting developments in our own platforms, we've also started to talk with other government partners to see if we can leverage our investment for use across the care economy. For software vendors, business to government or B2G's catalogue of application APIs will streamline information exchange between provider and government systems. In 2024, we launched 4 APIs to automate the exchange of data for authentication and registration, provider management, quality indicators, and nurses 24/7. Using the B2G developer portal, vendors can start their software conformance journey and start testing their own software against the department's APIs. We've got a big job ahead in digital transformation, and we know we can't do it alone. In 2024, we again prioritised connection and collaboration with the sector. We held 6 digital transformation Tech Talk webinars featuring 14 diverse speakers discussing a variety of topics from across our department, across government, and from the sector. This year, we've seen an average of 700 registrations per event and fielded over 200 questions from our very enthusiastic audiences, earning a satisfaction rating of 92%. Our Digital Transformation Sector Partners Group held 15 meetings this year, celebrating our 50th meeting in October.
Today marks a magnificent milestone, significant in our journey together.
We showcased 19 projects and 13 targeted co-design initiatives to foster collaboration and knowledge sharing across our community. Membership has nearly doubled from 119 members in 2023 to our current 225 members, representing 151 unique organisations across the sector. We're immensely grateful to our group for their ongoing commitment to co-create, co-design and co-deliver this sector-wide digital transformation. We literally couldn't do it without them.
I haven't seen an opportunity like this in the past, where providers have been asked a question about what their needs are, and then subsequent, the building has delivered to some of those needs.
We've actually got 739 out of 740 residential organisations have got at least one enabled user using the platform.
I was involved in giving feedback on the design of the GPMS system. We were actually testing the system before it went live and identifying issues and working with the Department of Health on those issues before it was put live out to all the providers.
This year, our guest speaker series received over 130 invitations to speak and participated in more than 52 national and international events. We held targeted deep dive sessions on our new digital solutions and launched our aged care digital maturity research workshops with key sector groups. These interviews help us understand the digital maturity challenges in the sector, gathering the insights and evidence to support the sector's digital growth. We're committed to sharing our story with the aged care community, industry and with government, exploring themes like technology, innovation, leadership and more. 2024 has been another big year. At the Department of Health and Aged Care, we're continuing to deliver real-world solutions to enable aged care reform, understanding that our work directly supports older Australians and those working hard to support them to live their best lives for their whole lives.
Well, there you have it, folks. That was the year in review for 2024. Hopefully, you guys should be all very proud of yourselves. We couldn't have done it without you in the sector. And there has been a lot of change, and I think we did it all very well together. So a big shout out to everyone, to my team, Janine and the team in the department and all those in here, but also out there in the sector. You guys have done an amazing job. So thank you very much. So, of course, we come to that time now where we move to the Q&A, and I've noticed there's a few questions in the list. And Janine, I think of our panel people, can we get them, some of our presenters back to the panel? We've got a few subject matter, we've got a few subject matter experts in the wings, just in case we need them as well. So with all of that in place, I'm going to throw to you, Janine, I think, and you're going to moderate some of the questions for us. Is that right?
Yep, that sounds great. So welcome back to our panel today. So in addition to Faye, we have Katie, Stephen and Amanda joining us, and we've had a good number of questions. So we'll jump right into it. I might just start by giving a couple of heads up. Just bear with me one sec, my text just dropped off. So if we can start by giving a stage warning to Dustin Pham and Stephen Stenton. So if you guys can go ahead and join for me. And while we're waiting on setting those guys up in the background, we'll start with an anonymous question. And this one is one of our most popular questions. It's had a number of votes up. So when will support at home technical specifications, requirements, expectations be available for providers and vendors to be worked on to update the software to support the new funding model? I've sort of mashed that a little bit, but I think we've got the gist. Faye, I might send that one to you.
Sure. Look, as soon as we have it, we'll be sharing. As you saw today for the first time, we did share what the roadmap looked like for next year for the February and the June releases. We will start to then, using those packages of functionality, we will start sharing that in our sector partner community, I think next Friday, to be honest. So it's in that sector partner community where the detail happens first. And then as we summarise it up, we bring it back to Tech Talk as well. So really, we've already started. We've already shared what the service categories look like. We've shared the roadmap, and we will continue to share more detail. If there's any particular piece that you need sooner rather than later, please provide that in the feedback or in a question, and we can take that offline and make sure we're prioritizing what information you guys need first. But hopefully, we've already started. There's going to be a lot of conversation and communication over the next 6 months.
Great. Thanks very much, Faye. And we're just still waiting on bringing Dustin to stage. So I will just answer another anonymous question. So someone asked, will this be recorded? And the answer is yes. We record all of our Tech Talk webinars. They are available on the departmental website, and they're also available on YouTube. So feel free to check it out later and share with your friends. How are we going with Dustin?
Looks like we've lost Dustin from the session. Janine, perhaps you could do the honours for us.
Yep, no worries. Thank you very much, Matt. Okay, so this one's in relation to GPMS integration. Is that integrating GPMS with providers' CMS is the question. Wondering if that gives our tech experts enough information. Amanda, do you want to have a crack at that one?
I'm not sure I have enough information. It sounds a little bit like a B2G specific questions in terms of integration. Is that, could we get a bit more info?
I think you're right, Amanda. So GPMS, the only way you can integrate into GPMS is through the open APIs. You're so right. And so those APIs are the ones that we deployed on our business to government gateway. So I know at the moment, I think if I read the question correctly, and it might be a different one, but it was about, you know, instead of using the Excel spreadsheet to upload, you can actually then use the API instead. That would require either yourself, like you have your own IT shop, or your software provider connecting to the developer portal and going through the conformance process. That way, when you update your systems, you can then press a button, and I'm oversimplifying, folks, but, you know, press the button to say report to government, and you can automatically send that information via a system-to-system connection. So we've started that journey with B2G APIs. As we spoke about earlier, there's 4 of them. We are prioritising another set for next year, more around the support at home parts to help with automating of that part of the aged care ecosystem. So hopefully that helps, folks. What's next?
Great. Okay. So we have a question from Stephen, but we haven't been able to locate him. I'm not sure if some of us are having technical issues in the background. So I'll go ahead and ask the Stephen question as well. As we prepare the service list for support at home, will we be provided standard terminology bindings for each service type, i.e. national standard, S-normed codes or equivalent? If so, will these be issued with the care services model or the support at home services list on the roadmap?
That might be one we might need to take on notice. I think definitely we'll be putting out care services information, the care service model. Specifically what you're asking for there, folks, we'll take it back with the SNOMED data and so forth, and we'll bring it back to you guys. So didn't quite answer that question, but we'll have to take that one away and come back to this. Yeah.
No worries. Can we ask Elaine Dunn to raise her hand? We're just having some technical problems identifying people in the background who are in the room. So if Elaine, if you can hear us, if you don't mind raising your hand, we'll come to you next. And Peter Cooper, who has also raised a question, if you can raise your hand as well, that will help our team identify you in the background and we'll be able to bring you to stage. In the meantime, GPMS integration, does that mean we will be able to submit our reports reasonably smoothly from our SQL Server database systems to GPMS without having to use the Excel middle step? If we would, they would rather not use the Excel middle step. That makes sense, right?
Yeah, and that's that open APIs piece. So in that particular, and I can't remember exactly which one, it might be called quality indicators. There's 3 ways of providing your quality indicators to us. The first one, you can go into GPMS and use the screens. The second one is you can use the Excel spreadsheet to upload. And the third one is go and connect with your software using the API on B2G. It's one of those 3.
Okay, great. Thanks for that. Okay, I think we're still having trouble queuing.
I noticed one there around care statements. Why don't we give one to Katie and
great.
Stephen?
So we've got a couple about the care statements, but is it expected that monthly care statements will become mandatory for community care?
Thanks, Janine. And apologies, I probably didn't make that clear enough in my slides that the monthly care statements is a requirement, well, we're still involuntary, but it is for residential aged care, not home care. And we know that in home care there are monthly statements which are a financial statement. So that's a sort of different model, which is about, you know, sort of care recipients being able to reconcile where their package has been spent, whereas the care statements for residential care is really about the care that's been delivered over the previous month, with the idea of sort of improving communication and transparency about what's happened in the last month.
Great. So we answered a couple of questions there in one, so that was useful. Thank you very much, Katie. There's also a question around monthly statements. Will this apply to home care providers' current model, CHSP, HCP, STRC?
So no, just these monthly care statements are targeted specifically to residential care.
Perfect.
Great. All right. Question about My Aged Care, Find a Provider website. We've got an anonymous person wondering if the website will become simpler and more user-friendly, fewer mouse clicks to open a provider. What do you think, Faye? That might be a you one.
Maybe. I thought I'd check in with Katie first if she knew anything. Otherwise,
oh, we've lost your audio.
Okay. How about that? Trying again.
That's better.
Excellent. Thank you. Sometimes the speaker decides to not connect. On that one, I'd really like to get some feedback on that one. If the person who's put the question up is prepared to actually show us, the way they do it and what they think they should be doing. This is that co-design aspect of, something's been created, but you feel maybe there's too many clicks to get to the right provider. We'd really love for you guys to drop us an email with some of that feedback. Send it to our DT engagement office. And I just got to get the right, email address there, folks. We'll
drop it in the chat.
In the chat, and please provide it, some feedback to us, because there'll be quite a lot of work that we're redesigning now for the 1st of July, and so we would love to hear that. We can look at it from a user experience perspective to say, is there a better UX that we can do? Thank you.
Great. We're still having trouble queuing people, so I'm afraid you're stuck with me. I shouldn't have mentioned it earlier about the first tech talk, because I feel like I've mozzed us now.
That's all right.
Okay, so this question is from Elaine Dunn. Will the results of the digital maturity survey be released to PHNs?
We'll make the results pretty transparent to everyone. So we'll start off by doing all of the workshops and presenting it back to the sector partner community who participated in that. Then we will be packaging up the results and sharing it on Tech Talk. If you as PHNs want a specific voice in it, again, please reach out and become part of the workshop participants. We would love to see and hear your perspective. Absolutely.
Great. Thanks very much. And we can drop a link and an email into the chat as well for people that are interested in following up on that study. Just on that one too, Faye, while we're talking about it, somebody did mention in the chat that the Aged Care IITC, so the Tech Council, had done some digital maturity research. Are you able to talk a little bit about how this aligns to that?
Yeah, so we're aware that there's been a couple digital maturity assessments. There's that one there, which is from I keep getting the acronym wrong, but the ITAC group. They've done one in 22 and 23 that we're aware of, and we do have a copy of. I do know that ADHA have also done one. It was either early this year or late last year. I guess what we've done here, which is a little bit different, and we will try and use that data where we can. Some surveys, they have not asked permission to be able to use the data again. So, sometimes when you collect data, you can only use it for the purpose that you've collected it for, unless you've given consent for it to be reused again. So to that effect, we will be asking for permission to reuse again in this survey, and we will be making it a digital framework that or methodology that we've shared out with many and who have contributed to it, so that it becomes a consistent digital methodology and assessment framework that we can reuse again. So yes, reusing where we can, because we have checked what we can and can't reuse, and then we will be making it available to all. Thanks.
Great. Thanks very much. Okay, this is a question from Peter Cooper. And I think it's probably one for Amanda. We have lots of incorrect information on the GPMS Manage Your Organisation tile for key personnel. We have submitted forms to ACQSC, so the Commission Notifications Office, up to 5 months ago, but they have not been actioned. So I know this isn't specifically about your tool, Amanda, but what would you suggest we do in this scenario?
Yeah, look, it is probably a bit more of a business specific question, but I'm happy to give it a go. So when we first launched the portal, we were aware that the Commission had a bit of a backlog of updates to make in the system. So when we did send out the launch comms, I think it did sort of note that it would take a few months for those changes to be actually processed and to show up in the self-service portal. But certainly, you know, you can either wait for that or you're more than welcome to jump in there and make updates yourself. So there is another similar question about end dating key personnel, and you can certainly go in there and just update your information if that's a bit quicker, or, you know, give us the information about your form and we can follow up on your behalf.
But isn't that actually the benefit, Amanda, why we did the self-service? So you don't have to fill a manual form or don't have to ring up.
I know, I didn't want to be presumptuous with a business call, Faye, because obviously if the information's been sent and we're asking it to be redone, I didn't want to make that call. Yeah.
Well, and there might be some scenarios where it can't be redone. So let's be honest, folks. I think there's certain, not all the self-service use cases are 100% covered. But where you jump in and you can update it for yourself now going forward, please do so. However, if you feel that you can't and you have submitted it before, yes, please reach out to the help desk and we'll follow that up for you. But I feel like it was a miss if we didn't call out the benefit of self-serve, so you don't, you know, that you get to do it in real time and you see it straight away. So excellent.
Great. Okay. Next question. Thanks for that one. So this is a question about the quality indicator terminology. Is it changing? Do we know that yet?
I think there was some changes that I did talk about at the beginning, and it is changes, I think, to line up with some of the new legislative changes. Let me just double check. It was about, yes, we're updating terminology in GPMS and B2G to reflect changes in terminology for the quality indicators. The actual detail I don't have at hand, but we'll take an action on that and we can definitely put more of that out there as it comes to hand.
Great. Thank you. There's a question about the tech conversation being all about residential care. However, some aged care providers are providing for home clients. How will all this tech planning and data be of use or guidance to the home sector? Also, any technology that is for at-home providers will need to be assessed for the participants that would be the users or receivers of such data, and many of those user clients may not be tech savvy. Correct. Okay, so two-part question there. First part.
Two-part, yeah. So
a lot of it sounds like it's for residential care. What do we have to say about home care?
I think because we've focused a lot on residential care in the last sort of 12 to 24 months. But if you look at where we're going in the next 12 to 24 months, it's all about in-home care. So watch this space. You will see a lot more on that. I think the key to understand is our underlying foundational platforms will remain consistent. So Aged Care Gateway, our integrated assessment portals and tools, GPMS and B2G. But now the functionality that we're going to be enhancing on it will be more in-home care. Different things will happen at different times, especially around when policy hits. So as you know, Katie, maybe in, for example, the care statements, that may not be something that's today, like in home care, it's very focused on residential. Who knows in the future if that changes, with support at home being the focus. I'm not putting anything out there, folks. I'm just saying, as the policy looks towards more support in the home, you will hear more of the digital and the tech following that as well. So hopefully that helps to answer some of your questions, or the question around that. From the second part of it, which was the digital part, which is, it's got to be used. Yeah, and so there is an element of baseline introduction on how to leverage the tools. Will be, I know the department material out there. Part of the digital maturity assessment is talking about how ready the workforce is for that, and then by using that information, we can then put new initiatives in place on how to help uplift the community. So we do recognise that there is a little bit of a gap around people digitally ready to adopt some of the new tools, and we have to work out how to get us all there. So hopefully that answers the question.
Thank you. We have invited Marina Mutakumaru to stage. Hi, Marina. We're calling in our phone a friend because we have a question that's specifically about B2G and APIs.
Thanks.
So the question is, what APIs are being refactored? Why are they breaking changes?
So we are looking to refactor each of the APIs that we've got out there at the moment to align with the changes that are coming through GPMS. Are they breaking changes? No. So it will be a transition process that will align with the changes as they come through GPMS and provide any of the people who are currently looking and developing against the current APIs to adopt them with sufficient time available. I hope that made sense.
Made sense to me. Yep, yeah, sounds good. Thanks very much, Marina. Appreciate you dropping in.
No, my pleasure.
Feel free to hang around if you'd like to.
I can hang around if there's any other questions to do with
else to stage. So
yeah, happy to hang around for any other B2G questions that might come through.
Awesome.
I do know that Faye got all of the answers. She was spot on before.
Did I get them right, Marina?
Yeah.
Did you want to add anything else?
No. So I think you were right on track with all of that. So thanks.
Great. Okay, change of pace. We're going to go to monthly care statements. Monthly care statements look like an administrative regular activity. What's in it for the healthcare receivers? How much would such projects improve the healthcare and wellbeing of the aged care resident healthcare receivers? So we'll put this one to Katie or Stephen.
Thanks, Janine. I'll take that one. Look, I mean, I think that there's a ring of truth in that around what the monthly care statements are really trying to do is perhaps put some consistency out there around communications that we want providers to have with residents. And we know that a lot of providers are probably are already doing this, but essentially what we're doing is I guess providing a bit of a baseline around what residents should be able to expect. I think in terms of what's the benefit to a healthcare receiver, there's a written statement which captures some core indicators of their health and well-being, which can be used to spur conversations with the provider, and also to communicate with their family as well, to open up a dialogue with family. But I'd probably also say that if indeed a resident doesn't find that the statements are adding anything because they're finding that their provider's doing a fantastic job of communicating and already, or they're just not interested, then they can choose to opt out from those statements as well. So there's no obligation that a resident would have to receive them. So I think we're trying to make it a useful add-on to the communication processes, but there's no element of compulsion that a resident would have to receive it if they didn't find it useful.
Okay, great. Well, I think we've basically hit time. So we have a number of questions still outstanding. As always, we'll collate those. We'll send them back to the relevant SMEs, and we'll come back to the audience with all of the really popular questions and answers to those. Thank you to our panel. Thanks, Amanda. Thanks, Katie. Thanks, Stephen. Thanks, Marina, for dropping in. That was great. And we'll get the slide deck back up if we could, please, folks. So that's it for us for 2024. This is the conclusion of our Tech Talk number 20. So happy 20th birthday, everybody. Thank you for joining us today. We really appreciate your patronage, not just today, but right throughout the year. Please take a moment to take our quick survey. It helps us make sure that we're giving you useful and relevant updates. The QR code is on the screen now, and that will give you a quick access to the survey. As we've mentioned, the recording of today's webinar will be available on the departmental website in the next few weeks. We'll let you know when that's available. In the meantime, you can access all of our previous Tech Talks using the QR code on screen online. Feel free to share those with your colleagues, co-workers, and to rewatch them yourselves. Until then, that's goodbye from me for 2024, and over to Faye to take us out. Oh, Faye, we don't have your sound. Oh, you're back.
What about now? Am I back?
Yeah, we've got you.
Excellent. So thanks, Janine, and thanks everyone for joining us. We'll be back in 2025 for another big year. And so keep an eye on our website and in your inbox for the first Tech Talk in February next year. Any agenda items or topics you'd like to see, please drop us a line. And thanks for your interest and contributions in 2024. It's an open forum. We love the diversity of views and opinions we see at Tech Talks. We look forward to welcoming you back next year. And if you know others with an interest in these kinds of topics, please pass the invite along to them. 2025 will be the biggest year yet we've got coming. So I hope you have an opportunity to get some downtime with family and friends and enjoy the holiday period. And take pause between now and then and just get some respite and care for yourselves. For now, that's it from us. And until next year, thanks for your company and goodbye.